Welcome to this second topic. Basically, we're talking about first aid during choking. Have you ever choked? What is choking, by the way? I do believe that choking occurs when a foreign object becomes lodged in the throat or windpipe, blocking the flow of air. So usually in adults, a piece of food often is the culprit. Young children often swallow small objects. So it may not be necessarily food for young children, but most likely they could have swallowed other objects like beads, as they play with other toys around them. So because choking cuts off oxygen to the brain, um, you need to administer first aid as quickly as possible. That is our introduction for choking in first aid. And our objective is that by the end of this topic, you should be able to define choking or explain how choking occurs, and also explain different first aid measures in terms of helping victims who've been choked, both adults and children. Now, the universal sign for choking is hands clutched the throat. If the person doesn't give the signal, look for these indications. One, inability to talk. Probably you are not there at that scene of accident or at that point when this person choked. So you may not have known what could have really happened. So you find someone, we're saying that the first sign, you'll find someone trying to place his hands or her hands towards the throat. But sometimes you may fail to see that the sign of the hands clutched to the throat. So you could also check out for inability to talk. Is this person able to talk? Could check on difficulty breathing or noisy breathing. Also inability to cough forcefully. Skin, lips, and nails turning blue or dusky, and also loss of consciousness. Why are we saying that you could check out on the skin, lips, and nails turning blue or dusky? Because usually when one is deprived of oxygen, especially like children, that we are likely to experience blueness in the skin because of the lack of oxygen towards the brain. So if choking is occurring, the Red Cross recommends a 5-and-5 approach to delivering first aid. So this means you give 5 back blows. That is, first deliver 5 back blows between the person's shoulder blades with the heel of your hand. So you nicely position your hand. You use the heel, not the fingers, the heel of your hand, and then you blow. You kinda press by kinda ni kama kupiga, but you're not hurting the person, but you're applying force. The major thing is force. So 5 means start giving 5 back blows, and then next we do 5 abdominal thrusts. So performing 5 abdominal thrusts, also known as Heimlich maneuver, is also important. So alternating the 5 blows and 5 thrusts until the blockage is dislodged. Also, the American Heart Association doesn't teach the back blow technique, only the abdominal thrust procedures. It's okay not to use back blows if you haven't learned the technique. So both approaches are acceptable. So to perform abdominal thrusts, that is the Heimlich maneuver, on someone else, you first stand behind the person and wrap your hands around the waist. You tip the person forward slightly. Then make a fist with one position slightly above the person's navel. Then you grasp the fist with the other hand. You press hard into the abdomen with a quick upward thrust, as if trying to lift the person up. Then you perform a total of 5 abdominal thrusts if needed. If the blockage isn't still coming out or is still dislodged, is still lodged within the throat or the throat area, you repeat the 5 and 5 cycles. So if you are the only rescuer, perform back blows and abdominal thrusts before calling 911 or your local emergency number for help. If the person is available, have that person call for help. You perform the first aid. So if the person becomes unconscious, you need to perform standard CPR, which we already talked about in our previous lesson, the cardiopulmonary resuscitation with chest compressions and rescue breaths. So to perform the abdominal thrusts on yourself, you first, if you are alone and choking, you call 911 or your local emergency number immediately. Then, although you will be unable to effectively deliver back blows to yourself, you can still perform abdominal thrusts to dislodge the item. So you place a fist slightly above the navel, then you grasp your fist with the other hand and bend over a hard surface, that is like a countertop or chair wheel. Shove your fist inward and backwards. So to clear the airway of a pregnant woman or obese person, how do you go about that? Because remember, you're not going to apply a lot of pressure on the abdomen of a pregnant woman. So you position your hands a little bit higher than with a normal Heimlich maneuver at the base of the breastbone, just above the joint of the lowest ribs. Then you proceed as with the Heimlich maneuver, pressing hard into the chest with a quick thrust. Repeat until the food or the other object which is lodged is dislodged or the person becomes unconscious. Clear the airway of an unconscious person. Kama mtu ameishiwa na fahamu, how do we clear the airway? You lower the person on his or her back onto the floor. Clear the airway if a blockage is visible at the back of the throat or high in the throat. Reach a finger into the mouth and sweep out the cause of the blockage. Be careful not to push the food or object deeper into the airway, which can happen easily in young children. Then you begin cardiopulmonary resuscitation if the object remains lodged and the person doesn't respond after you take the above measure. So the chest compressions using CPR may dislodge the object. Remember to recheck the mouth periodically. So to clear the airway of a choking infant or younger child less than 1 year old, how do you go about that? An infant. You assume a seated position and hold the infant face down on your forearm, which is resting on your thigh. Thump the infant gently but firmly 5 times on the middle of the back using the heel of the hand. Then do a combination of gravity and the backward blows, which will release the blocking objects. Hold the infant face up on your forearm with the head lower than the trunk if the above doesn't work. Using 2 fingers placed at the center of the infant's breastbone, give 5 quick chest compressions. Repeat the back blows and the chest thrusts if breathing doesn't resume and you call for emergency help. Begin infant CPR if one of these techniques open the airway but the infant doesn't resume breathing. If the child is older than 1 year, you give the abdominal thrusts only. We're saying that if the child is below 1 year, you're going to use the back blows. Are we getting the difference? Oh, yes, I do hope so. So to prepare yourself for the situation, learn the Heimlich maneuver and CPR in a certified first aid training course. Like we have in Kenya, we do have the St. John's, they do offer, and also the Red Cross. Excuse me, the Red Cross also do offer first aid courses. There are those basic first aid courses. It's important that you get to know about them and how they are done. True choking is when a person is unable to breathe or speak due to a complete obstruction in the throat or windpipe. And this airway obstruction can be caused by an inhaled foreign body like food, trauma, or internal swelling associated with a severe allergic reaction. The onset is likely to be sudden when caused by an inhaled foreign body, but more gradual in onset when due to internal swelling. So in partial airway obstruction, the patient will be able to breathe and cough, although there may be a crowing noise that is treated as air passes through a narrowed space. Usually the patients clear a small foreign body by coughing, and although the breathing may be noisy, air can still enter and leave the lungs. At this stage, it is important to avoid avoid giving back blows, which may cause a foreign body to move and become a total obstruction. Okay, so symptoms and signs, not all may be present, but in terms of choking, of course, we say that you could check for breathing, which could be labored or gasping or noisy, air escaping from the mouth, patient coughing or making noise, extreme anxiety or agitation, pale or bluish skin color, total airway obstruction, like patient may be unable to effectively cough, breathe, or speak with no air movement. Also, patient making obvious efforts to breathe with indrawing spaces between ribs above the collarbones. Also, patient's face. Also, patient's face is grayish in color with blue lips due to lack of oxygen. The patient clutching the throat with both hands, that is the universal sign for choking. Then we have partial airway obstruction. How do you check out partial airway obstruction? Not total, but partial. So never use back. How to help? Never use back blows on a person who is able to cough effectively or breathe. So ask the patient, are you choking? To determine whether the airway is completely blocked. Then reassure and encourage the patient. Stay with the patient until full recovery has occurred. Encourage the patient to cough and exhale the foreign body. If the obstruction is not relieved, call an ambulance or emergency number for help. The total air obstruction, how do you help in such? First, if the patient is conscious, give up to 5 back blows. So with an adult or child, standing or sitting and leaning forward and using the heel of one hand, you give the back blow between the patient's shoulder blades. You place a baby face down on your lap for back blows. Ensure you support the baby's head, and you give firm but gentle back blows to avoid physical injury to the baby. If the patient is conscious, give up to 5 back blows. If unsuccessful, give up to 5 chest thrusts. So with an adult or child, standing or sitting, wrap both arms around the patient at chest level. Then place one fist in the thumb, side against the middle of the breastbone. Grasp that fist with your other hand and give up to 5 separate inward and upward thrusts. Continue the thrusts until the obstruction is dislodged or the patient becomes unconscious. Then you place a baby face upwards across your lap and give up to 5 sharp chest thrusts, but you ensure that it's just below the nipple line. So the chest thrusts are given separately with a check after each one to see if the obstruction has been relieved. Note that a small child can be positioned across your lap. So if the obstruction has not been relieved, we need to continue by alternating the back blows and the chest thrust until the ambulance arrives or help arrives or medical personnel. For an unconscious patient, how do you help? Quickly check the mouth. Why do we check the mouth? We are checking in case there's an obstruction and also for breathing. So use your fingers to remove any visible solid obstruction. Then begin CPR and continue until the ambulance arrives. There may be some resistance to inflations at first until the object has been dislodged. So we have an illustration there in our notes. We have an illustration showing how we can help a baby who is choking, because we ensure that you help the baby face downwards with the head raised slightly above the trunk of the body, and you apply the first 5 back blows so that we dislodge whatever thing that could be choking the child. Then we say that after that, can also try, in case the thing doesn't come out, whatever could be choking the child, we put the baby on our laps and then we do some chest thrusts. We give chest thrusts just by use of 2 fingers. We don't use an entire arm or entire hand because it may apply more force to the little one. So how can I give my baby cardiopulmonary resuscitation? There are people who would want to help the children in those times when children are not able to breathe by themselves or normally. So if you have someone with you, get them to dial an emergency number for ambulance for help. And while you begin the CPR, if you're on carry out the CPR for 1 minute before dialing for an emergency help to so you quickly identify the problem baby is choking. Follow the steps described above to clear his airway. Then your baby is unconscious, try to get a response by pulling his name and on the stool of his gently on the sole of his feet. Your baby is unconscious, but breathing normally. Just hold him on his head tilted as if you were giving him a cuddle. So with his head lower than his tummy, everything in your gut. If your baby is unconscious, having trouble breathing, use oxygen when the airway. And remember, we talked about the ACs from the airway, kneel at the right angle to baby's chest. Then place one hand on his forehead and lift his head back. Make sure his head and neck are in line. When using your other hand, use one finger to lift his chin. Then look at your baby to remove any visible obstructions in mouth and nose. Then look, listen, and feel for normal breathing as shown. Allow only up to 10 seconds for this. If it is breathing, begin the CPR. That is a combination of chest compression and rescue breaths. Another person is present, ask them to follow ambulance straight away. So you need to give 5 rescue breaths. You open baby's airway, then seal your lips around your baby's mouth and nose. Blow steadily into his lungs and check that your baby's chest rises as you breathe into him. Fill your cheeks with air and use this amount each time. As the chest rises, stop blowing and allow it to fall. Repeat this 5 times. You need to give 30 chest compressions and ensure that your baby is on a firm surface. Place 2 fingers in the center of the baby's chest. Then imagine a line between your baby's nipples. So find the middle of the line, that line, and measure about 1 finger's width below that point. Now position 2 fingers of one hand on that spot. Press down sharply to 1/3 of the depth of the chest. Then press 30 times at a rate of 100 compressions per minute. Eventually also do after 30 compressions, give 2 rescue breaths, and then continue resuscitation. That is 30 compressions to rescue breaths without stopping until help arrives. So if you're alone, just call the ambulance or help the available contact for your country, and I believe you know Kenya, performing 1 minute of resuscitation. If you're unable to give rescue breaths, chest compressions alone. So keep checking your baby for signs that he is breathing again. Look out for normal breathing, coughing, and moving arms and legs. So basically today we are covering the choking, and it's just important for you to know the basics. That in choking, we do apply some blows, and we're saying that there are 5 blows, 5 by 5 approach. We're doing 5 blows and also 5 chest thrusts. But again, in children, we may do that, but we also have to be careful so that you're not doing your chest thrust with the entire base of the arm. sole of the arm, we do with 2 fingers. Or if you have to let it to the gently because children are small. So that is it for today. I want to hope something you've picked. You can keep reviewing your notes and this audio so that you can be able to understand what I've taught you during this class. In case there are any queries, let's engage in our live class and hope to see you there.